Hello, everyone. Welcome to today's webinar. My name is Kathy Adamick, and I'm here with Jill Westring. And we are excited to be presenting the first in our series of decision-making webinars for 2019. We're going to go through, it's best if through the decision making. It would be helpful if you had your personal outcome measures manual with you. It will help you to be able to follow the decisions. We will be recording this webinar, and the slides and the webinar will be available for you probably by the end of next week. We are able to keep track of who's attending the webinar if you registered and signed in as yourself. If there are multiple people in the room, of course, we would only know who the person is that signed up. But we do have those records, and we're happy that you decided to join us. They will count towards your requirements for maintaining certification as you go for your recertifications. So, Jill, would you like to say anything?
Good afternoon. This is kind of my first time being seen, so if I'm taking a drink or something, forgive me, but I'm going to try not to watch myself. So you just watch me and tell me if I do anything weird. So welcome. Welcome. This is the second series of Personal Outcome Measures Decision-Making Series. We had a series last year with 6. We will have 6 again this year. You can sign up for all 6 on our website. Seth has those all out there, so you can ink those in. The times and dates are, the times will always be 1 o'clock. The dates, we were trying to get them in the same week of each month, but we had to adjust. I believe it's June, but you can look at those and sign up ahead of time and get those on your calendars. Anything else, Kathy, before we start?
No, I think that's great.
Great. For this year, we are going to be talking with Lennon. And Lennon, we are going to be going through the first 4: safety, best possible health, experiencing continuity and security, and rights. If you were on last year's session, or if you are a newbie to us, what we do is that we introduce a person, and then we kind of talk about what is in each of the areas of those 4 for this hour. You will have the opportunity then to make a decision from the decision making in the POM manual as to whether the outcome is present and the support is present or not present. So with that, I think we shall start, and you'll get the hang of it. When I met Lennon, we just talked about the things that you and I might talk about if we were meeting for the first time, of kind of who you are. Usually I don't ask people how old they are. I just happened to do that with her, and just kind of talked a little bit about her life. And some of the things with Lennon is that she is 31 years old. She lives in an apartment. She works at Pizza Hut. She likes to shop a lot. Her favorite things include shoes, bohemian clothing, and decorations in the bohemian style, hosting dinner parties, and baking bread. She's interested in flower gardening, acting, and photography. She's not married, has no children, but has twin nieces, Ashley and Taylor. So after we had this discussion and we kind of talked a little bit, we kind of went into the interviewing process, or a little deeper conversation. And throughout the whole thing, I've put them back into the areas of the personal outcomes in 1 through 21. So we were talking about her safety, and if she was safe at home and at work and in her community. So Lennon knows what to do in severe weather. There's a manager in the complex that is always available in her apartment complex. She will leave her apartment in case of severe weather, will go into the community laundry room in her apartment house when there's a tornado warning. A potential risk has been identified that frightened her. She sometimes will share too much information with people she knows and doesn't, or I'm sorry, people she does not know well. An example would be that she was telling the clerk at Walgreens about her family and her family history, and it was just a little too much information. The organization is providing no formal education as to what risk that involves. And a few months ago, she gave her address and phone number to a man who had called recently and stopped by late at night. And she said that kind of frightened her. She had reported the incident to her program coordinator, and they discussed it. Although no formal strategies, they are talking about what risks are and who to talk to and information that one might give to someone that you don't know well, like your address and phone number. So with that being said, and I kind of give a little more information. Sometimes I will just read it from the slide, and just to make sure we're all on the same page. So based on that information gathered and the things that you've heard, does Lennon live, work, and pursue leisure activities in environments that are safe? The first of the outcome decision making. The second would be, does Lennon know how to respond in the event of an emergency at home, at work, and in the community? She does have a cell phone, and she does have phone numbers to call. Are her safety concerns addressed at this time? So this is your poll, and for Lennon, is her outcome for being safe present today? So you will vote on whether or not it is or is not present.
So Jill, this is Kathy.
Yes.
And so in terms of for Lennon, whether or not her outcome for people being safe is present, 29% of us believe that her outcome is present, and 71% believe that there's an opportunity here and that it's not fully present.
Very good. The poll says that in many, many ways, she is safe. She's living on her own. She knows what to do in severe weather. The problem with the individual information and kind of giving out that information would be the evidence that says the outcome is not presently for Lennon, that she needs a little bit more opportunities for education on who and when she would share information with others, especially kind of strangers on the street. So the answer to that is that she is not presently safe for the outcome.
Great.
Go ahead.
So, are there any questions about that? You may type them in the question box, but we'll move on to support as we're looking at those. So now the next question, and most of you have already answered this, is the support for Lennon's outcome, people are safe present? 28% said yes, and 72% said there was an opportunity for individualized supports for the outcome to be present.
And again, for those same reasons and rationales and evidence that from what we have is that there is not formal education being completed at this time for it. There's lots of informal discussion and there's safety, and she would tell her program manager, and we know all of those things, but the opportunity is indeed present for her, so that support is not present in this particular case to the robustness that she needs with the education regarding when and where you would give information to people.
So Jill, a question is, how is that different than sharing personal information? Why is that considered at this outcome instead of just at the outcome people share personal information?
That's a really good question, and it will probably come up again in sharing of personal information. However, this, because it's a safety, and she was frightened because this person was calling and kind of was calling and stopped by at an inappropriate time for her, inappropriate, and she had not invited him. That safety would come out of here also, both in outcome and supports.
Okay. And Jill, what would you recommend that the agency do in terms of supports to make sure that this outcome is more likely to be present?
I think the part that's missing here is that there's no formalized, so that we make sure that everyone knows that this is a potential issue for her. And so if there's a formal support in place for her, that the organization, not necessarily tracking, but in some way making sure that everyone knows, and so that we're discussing this and making sure she knows what is right and what might be a potential safety risk would be.
Okay, thank you. I think that answers the questions. So I'll stop sharing.
Any other questions on that? We kind of have the questions up here, so I still see the polling, Kathy.
Is it gone now?
No, can I exit out myself?
Yeah, I closed it, so I don't know how to. Yes, please
Okay.
do.
Okay, so the safety is, as we went by there, it's I guess we've already gone through that. So Kathy has gone forward. So now we talk about abuse and neglect, and people are free from abuse and neglect. And so we want to make sure that Lennon, and everyone, of course, is free from past, present, or potential abuse and neglect. When Lennon first moved out of her family home, some of her family would stop by her new apartment. They would take some food and clothes and any cash that Lennon had with her. Prior to moving away, her family would take her Social Security money, her EBT money, and her paycheck. Sometimes Lennon at that time did not have enough money for the bus, so she walked. I'm sorry, that's supposed to be past tense. Walked to work due to the family taking her money. And so she didn't have any cash in there. So at that point, there was a representative payee appointed. And Lennon has distanced herself from those family members, but they still occasionally contact her. Lennon asks staff and that's preferably Sharon, help her with her mail, because sometimes she'll get letters from her family asking for money. Next slide. Lennon and her staff open the mail and read the mail together to determine if it's a request for money from her family, an advertisement, a bill, or something else. She's learning to make that determination, so that's what they're doing for that kind of education with her. Lennon said that she tells Sharon or the staff with her, or calls her program coordinator if she has any problems understanding, or if she opened the mail and she didn't know, or whatever that might be. The program coordinator was confident Lennon would tell her if someone was trying to take her money. And it's been almost a year since family has contacted her about that or asking for money. And so that's what the next says, that since she has gotten a call from her family. Both Lennon and her program coordinator said they talk about abuse, neglect, and exploitation. They also talk about what she should do if she feels that she is being mistreated. The program coordinator said Lennon doesn't use social media to avoid her family, and that's her choice at this point. She does use internet for shopping. If you remember, she likes to shop a lot. Education regarding A&E is conducted, and Lennon feels that she and her money are now safe and is not concerned that family would take it any longer. Human Rights Committee reviews that representative payee regularly due to the past exploitation of her money, and Lennon is present at every review regarding her finances. Next slide. So based on that information for the outcome, does Lennon understand the meaning, any allegations of past, evidence that she's been abused, and is she experiencing distress from any of the occurrences, past, present, or present? I think we've got a poll then, Kathy? Oh, sorry. The additional considerations that are in the manual. A method to correct it must include support, allegations that were reported and investigated and something changed, lack of intervention where staff have knowledge constitutes abuse or neglect, and if Lennon would continue to feel distress with the allegations, the outcome is not present and unable to determine her definition, the outcome would not be present. So with that being said.
So Jill, let's go through the support question, since when I launch the poll, the support question will also be up there. So could you go through the support questions, and then we'll launch them both at the same time?
Very good. So y'all keep in mind what you would decide for the outcome as we go through the supports. Does the organization know about Lennon's concerns about abuse, neglect, exploitation, or mistreatment? Does the organization provide Lennon with information and education about those things? Is the organization providing support for Lennon if there have been concerns in the past? Does the organization provide support to Lennon if she is in danger or risk of harm presently? Are any of those, according to organization policy, procedure, and applicable law, have they been investigated? So for your supports, and again, when we go through these, you will not be deciding whether or not it is that actions are being done. It's either a yes or no for this purpose. The additional considerations are the same as they are for the outcome, a method to correct it. Any allegations are investigated regardless of the source. Lack of intervention constitutes abuse and neglect. If Lennon continues to feel distress, the outcome's not present, that's the outcome, and unable to determine the person's definition, the outcome's not present. So we're launching for both the outcome and the support for you all to make that choice.
So if you're on the phone, you will not be able to vote. If you are, there should be just a way that you can press the yes or no button on the screen when you're voting, for those of you that haven't voted before. Okay, I'm going to end the polling. And here are the results, Jill. So in terms of the outcome for Lennon, 61% said the outcome is present. 39% said no, it is not present. For the supports, 82% said the support is present. 18% said it's an opportunity.
According to CQL, that the outcome for Lennon being free from abuse, neglect, and exploitation is present. That she is free from it. There have been past, we know that she has said that both of those things, she is not in fear, she is not in distress over that being done any longer, because she has a different representative payee, and that she feels that her money and herself and her finances are secure and okay. that she feels no distress over that. The support is also present. The organization has worked diligently to set that up. It is being reviewed by human rights there on an ongoing basis to make sure, because of those past issues, that it is not happening again and that everything is free and clear for that. So both of those are present for Lennon, even though there is evidence of past, she is okay. Remember, the last question is the person still in distress from any past abuse, neglect, exploitation, and or mistreatment?
So, Jill, we have a few questions.
Excellent.
The first question is, our agency serves as the rep payee for several people. They do take the rep payee through the Human Rights Committee, but haven't been doing any teaching. We don't foresee that the payee situation would change regardless of teaching. How are people getting around that when the state comes to recertify?
Okay, and it's not really getting around it. What we want to definitely make sure each and every time that the representative payee, whether it is the organization or someone outside of the organization, external to you, that there is a robust assessment as to what would the person like to do, perhaps within that. The rep payee may indeed always be there and may not. We can't say that, but is there something else they would like to take care of, such as their EBT card? Or would they like to have a prepaid card that they can use instead of asking for their money all the time? Would they like to know a little bit more about how their money is spread out for their services? How much goes to their staffing, perhaps? How that all works. And quite frankly, sometimes people, banking is a very kind of obscure sort of thing. Somehow money gets into an account and then we can get it out somehow, either with a debit card or prepaid or cash or a check or whatever that may be. So we want to make sure that we're not limiting people. Well, actually, I should say that it's the least amount of restriction for what they may want or desire.
Right. Good, Jill. And I would just like to remind people that the Human Rights Committee is reviewing this too as an impartial part of the due process. And so there are due process procedures described in the personal outcome measures on page 29. And due process by that definition requires that there be some kind of support for the person to regain any limits to the rights that are restricted. So to take those away. So whether it's the rep payee or anything else, we'd always be looking at what supports are in place to help the person, as Jill said, to learn to manage their money more independently. Again, making sure that if they're saying no, that it's an informed choice not to.
And we would certainly never say that that people would not need support in that. We do not want people living under the bridge or being homeless.
Right, absolutely. So the next question, Jill, is how far in the past would you look at an incident of abuse, neglect, or exploitation having occurred for the person to be considered free from abuse and neglect?
Good question. There is no time limit there to that past. There are people that will suffer from distress for all of their lives, and there are people that it could happen to last week and say some sort of physical abuse of some sort, and they know the person is in jail and they have had counseling and they know that that person will never ever be in touch with them again, and they will never see them. So it really is an individualized dealing with that. We just need to make sure that they're okay and that they feel safe and that they know that that won't happen again.
Thank you, Jill. And if when we're responding to your questions, if we don't answer them in the way that you wanted, please feel free to ask again or ask for more clarification.
Absolutely.
So does a person need to understand the meaning of abuse, neglect, and exploitation for the outcome to be present?
The actual verbiage is what I'm hearing you ask. That, define abuse for me. No. The short answer is no. The long answer is, how do we know that people know they're not supposed to be harmed mentally, physically, sexually, or emotionally? How do we know that people are not mistreated or that people are taking their money with exploitation? We can say those words afterwards when we're educating, but what we really want to know, I don't go into an interview and say, can you tell me what abuse is and have you been abused? We took that question out of our manual because that could bring up very bad, that could put somebody in a crisis. We want to know that they are not to be harmed emotionally or physically in any way. And as far as neglect, we talk about things, we ask questions such as, if you're hungry, do you have enough food? If you're cold, can you turn the heat up? Do you have enough warm clothing? Are you cold at night? If you're hurt, are you seen by a doctor? We want to make sure that those sort of things are in place. And so the short answer is no. The long answer is yes, we expect that there has been education on what to do if you're hurt and what that means.
Okay, Jill, I'm going to combine a couple of the next two questions. One person says that they agree with the outcome, but when she looks at the decision-making questions, at 2.3, it asks if there's any evidence, and there is. So 3 questions are no, and 1 is yes.
Right.
So can you help? But then the other question that someone asked is that perhaps she's feeling distressed because she avoids social media and she's concerned about and reviewing her mail in case there's anything else from the family. So, how do we know that that's not an indication of her being in distress?
And that's a really good question. She has requested that staff help her, and she is being educated and learning about what to do when those things come in. It's been over a year for her, and she said that she's feeling okay with that. And as far as there is evidence, and again, if we go back, even though there's evidence of it, she is not in distress today. And you know what? I put my manual down around the corner, but Kathy, if you could look at that and see what the numbers are and what I could find my manual.
Right, Jill, I can. So the real issue around these is that is she experiencing distress? And so 2.1, does the person understand the meaning of abuse, neglect, exploitation, and mistreatment, is a question that we ask for information and to help us to determine whether or not she has an understanding. Question 2.2 is, have there been any allegations of abuse, neglect, exploitation, and or mistreatment by or on behalf of the person? 2.3 is there any evidence that the person has been abused, neglected, exploited, and or mistreated? So either 2.2 or 2.3 could be yes. 2.4 really is the point at which it hinges. Is the person experiencing personal distress from any occurrence of abuse, neglect, exploitation, or mistreatment, no matter when it occurred? And then the explanation is that if the answers to 2.2, 2.3, and 2.4 are no, the outcome is present. I think the difficulty for people is when the answer to 2.2 is yes, the outcome could still be present. It really hinges on 2.4, which is the person experiencing distress? Right?
Yes. Sorry, I didn't have my book. That was crazy.
That's all right. Okay, so
Thank you, Kathy.
sure. So, another person is saying that in the past they've understood that if there's ever been an allegation of abuse, neglect, exploitation, or mistreatment, that the outcome cannot be present. Could you talk about that a little bit?
Yes, and if you would go from this point forward, just as Kathy discussed, that hinge pin actually of, are they experiencing distress? Because today I'm not distressed. Today Lennon is not distressed about that past exploitation for her, and so she's clearly living today free from abuse, neglect, and exploitation. So it's a very present piece that we want to look at of whether or not I'm experiencing that today. I could be in counseling with supports for that, and I could be in all of those things, but I'm still not free from it. I still worry about it. I'm still concerned. It's kind of it's just part of my world always, that someone is going to steal from me and or harm me. And so is it present today? It's a present tense. Am I free from it today?
Okay, thank you. So, there are a couple of questions kind of hypothetical. So if there was a lack of the HRC review of that rep payee, would the support be present or not present?
Well, that is a robust support continuing for her. For Lennon specifically, it's quite present. It's quite possible it might not be, because well, if it's never been reviewed, we're going to get that in treated fairly when we go down for that due process for rights and treated fairly. And free from abuse and neglect, it's been through there, and it had been reviewed. It's just that they're reviewing it more often than not, just to ensure, not for Lennon's sake, but for the organization, to make sure that it's all very, very strong for her. Did I answer that question?
I would agree. I would agree with you, Jill. I think that it contributes to the robustness of this particular support. It is possible that it would not be necessary, but for Lennon, because of her circumstances, I think, because she specifically wanted a rep payee and is actively involved in that I think that's part of that. So I hope that answers the question.
Yeah, they just took an extra step. They had already reviewed it through human rights, which we require it only being done annually. But for them, it's that next step up for them.
Right. Okay. And then if there wasn't, in an example, if there was an incident of neglect where the person was left alone and nothing happened to her, she felt pride in the fact that she handled the situation appropriately. Right. Would that be a consideration of being free from abuse and neglect?
Well, that would depend on the organization and what her hours of supervision would have been, and if it was 24/7 and she was left alone, there's going to be a neglect issue. If there had not been a team and a team meeting and a restoration process for her to be alone for an hour, and if she's feeling really good about it, I would say that her plan and her rights restoration needs to be looked at very closely. But according to the law, policies, and procedures, it would probably come up as neglect, yes.
And certainly in the support section, it is possible that her outcome could be met. but it is likely that many of those issues would be issues in support. And if it's not been investigated because she wasn't distressed, it's probably going to affect both the outcome and the neglect because of the additional considerations, the
Yes.
outcome and the support.
Yes.
Right. Okay. So when you're making decisions about people's outcomes and supports, kind of what do you do to balance what the individual wants with what the person's capabilities are?
Well, first of all, the outcomes are the person's and their perceptions. And so I don't really have to balance anything with that. Using the manual and the questions for that, making sure I have enough information to say that this person, this is what they want. So their perception and their desires on the outcome is theirs alone to own. It would be going onward with the identification of the supports. If the person wants something different than what the organization wants, how do we balance that? And we balance that by finding out what's the next step that the person can take in order to get rid of organizational supports if they don't want that much.
Okay, this is certainly a very important topic, and we don't want to say that the outcome is present if we're not confident it is, and we don't want to say the supports are present if we're not confident that it is. And because we want to make sure that people really are truly free from abuse and neglect. So thank you for your great questions. I appreciate that very much.
Really good discussion. Thank you.
So hopefully I'm moving on to the next one, Jill.
Yeah, I just needed to close out the poll.
All right.
Lennon, 32 years old, had some arm pain recently. She was seen by a physical therapist. She's pain-free at the time and has exercises she does now to keep her arm flexible. There was some sort of, she was having trouble reaching, and so now she's got some exercises and it's all good now. She has annual physicals as well as dental, eye, and has no other specialties for her exams. There was some concern about sleep deprivation. She wasn't sleeping very well, and some just general not feeling well, but those have all been remedied at this time. She didn't have I'm sorry, excuse me, let me throw that phone away. I'm very sorry. And she got onto a little better routine of sleep, and she'd had the TV on at night, and so she'd wake up and start watching TV, and so they kind of helped her figure out, what's a good time to go to bed or sleep or when to turn off. They put a sleeper on her, the timer on her TV, and that kind of went away. She feels that all of those things have been effective, and she feels quite well right now. She doesn't like her annual OBGYN exam, but she understands the importance and will go ahead and do it. She does not need mammograms yet. She's 32 and has no history of breast cancer or issues regarding that, so she doesn't have to do that yet. Next page. The organization currently assists Lennon with transportation for all appointments. She does use the bus system, the local community bus. She has a daily, monthly planner and keeps track of her appointments. She'd like to be able to keep her own appointments and not have to have staff go with her. She and her team have a plan to do so. She's working on that. She takes her multivitamin every day without supervision. Decision-making, best possible health. Does Lennon see healthcare professionals? Have they identified her current best possible health and issues or concerns and interventions? Have they been selected by the person? The interventions. Now, many times we get a lot of questions, and I'll just want to put this out here in the beginning. We're talking about the interventions and not the healthcare professional themselves to be chosen So it's the intervention. Does she know what they were doing, what they need to do, but not necessarily the doctor in this particular thing. Have they been effective? And any equipment, glasses, hearing, dentures available? And does she see her exam and dentist and eye and hearing and PAP and mammogram screening and any other screenings? So if the answers to 1, 2, 3, 4, 5, and 6 are yes, the outcome is present. So if you'll keep that in mind, take a second to think about that. And we're going to go on to the supports. Does the organization know her definition of best possible health? Are supports provided for her to promote and maintain, if needed and requested? Does the organization assure that Lennon has support to obtain regular medical and health services? Does the organization respond to Lennon's changing health needs? Is she supported to be aware of her medical issues? And is she supported to manage herself, her health? Based on these answers, with additional, if they're not aware and the supports are not present if we haven't been addressed, and if the person does not have regular medical and health services, supports are not present. So polls up for both outcome and support.
So Jill, here are the results of the poll. And so many people, 85%, determined that Lennon's outcome for best possible health is present. 15% said there was an opportunity. And 78% said that the supports are in place as well. And 22% said there was an opportunity.
Right. The outcome is indeed present for Lennon. She had some arm pain that has been remedied. She has her physicals. She's 32. And her dental and eye. She has no additional sort of things that she needs. There were concerns about sleep deprivation that has been remedied as well. She feels all of the procedures have been effective, and she feels good. She doesn't like her OBGYN exam nor her mammograms, but she understands the importance and agrees to those. The organization is indeed assisting her to make sure that those things are taken care of. And there's a plan in place, well, a plan in progress. She's actually doing it, working on it at this time to keep track of her own appointments, to let the organization know when her appointments are coming up and make sure that she has transportation for those. So both outcome and support are present for Lennon for best possible health.
So Jill, if there were, if she was still experiencing pain from her arm, would that make a difference in the outcome?
Probably. If she still has pain and she's not being treated for it, the supports would be there, but the outcome would probably not be there because she wouldn't, if she did not feel that she was in the best possible health, that it hurt that much, and even though there were things happening and therapy going on, it would be up to her whether she would say that she was in best possible health with that pain.
Okay.
So again, I can't say for sure because she says it's okay, but if she said it wasn't, then it would not be.
Okay. All right. Thank you. So frequently when people are interviewed, they might say things like, well, I take this pink pill and there's another blue pill, but they can't really name them or even identify what they're for. And it's possible that may be something to do with their cognitive ability. This person says, so I don't like to count that against them in terms of the outcome not being present. Is that correct?
Well, you threw a twist in there for me at the end. We would not expect people to generally say what the name of the pill is because it's like alzangarangopopan. And so those, you know, nobody can pronounce them but the pharmacist. But we would certainly anticipate that they would know that they're taking medication for certain things. Is it for your tummy? Is it for your head? Is it for your arm that you said you had pain in? Is it for something with your blood pressure? Is it so? When I'm talking to people about those pills, you know, I'm kind of talking to them as to why. Is it so that you can sleep better? And we would certainly anticipate that organizations and expect organizations to be doing that on an ongoing basis so that at some point that support would be there. The outcome may not be there because they really don't know why. I mean, not even close to why. And when we find people that say, well, not just they don't know why they're taking it, but they're under the illusion that they're taking it for one thing when they're actually taking it for something else, for some sort of anxiety is the one I see most often. And they say, oh, it's for my blood pressure or for my cholesterol, and it really is a Lexapro or something for anxiety. And so we want to make sure that people aren't fooled. The other thing that I'm coming across more and more is, and it just happened recently, was that pharmaceuticals changed the color and shape of pills. So, you know, we're having lots of discussions now about, you know, is it the blue pill? Is it the pink pill? Well, they've changed it from pink to white, and they've changed it from oval to round. And so, you know, that kind of throws everything that we've done out the window. So, you know, that's something that I'm struggling with people now also. So, you know, I think we're looking at talking about more of what it is you're taking it for and maybe how many you're taking, so that you, as you start, you can look at it and go, oh, I always take 5 pills, and I still take 5 pills. If there's 6 or less, 6 or 4, then I know that something's wrong. So, you know, there's some other things that come into play there. If they're old medicines that we know stay the same no matter what, you know, the colors are kind of cool, but more often as to why, and the outcome would not be present for people who don't have any clue as to why. And the support could indeed be present because we're always telling them, and we're talking to them about it at every med pass.
Right, and that's a great point, Jill. And the other thing that I always like to think about too is if people are evaluating whether or not the medication is effective, whether or not the intervention is effective, or even knowing what their options are, because sometimes it's medication plus diet, sometimes things can be controlled with diet. And so how are they determining the effectiveness if they don't know why they're taking something? So if I don't understand that I'm taking medication to make my stomach feel better, and my stomach continues to hurt, how do I know? I mean, you know, what needs to change? So I think that that's an important consideration as well.
Right.
So I think, you know, you're right. You don't want to necessarily have people identify the specific name of the medication, but, you know, knowing why they take it and whether or not it's effective is a good practice. So someone else says, so why is the outcome present? Because she's not independently self-managing her health care.
She is, okay, so the questions for the decision making is the person desired for the, you mean for the outcome? The outcome does not have management of self medication, just that the interventions have been. It's the support that if the person supported, is the person supported to manage healthcare in the decision making? And so for that, they are in the process. They are working with her and on it presently. And so they are managing. She is learning to do self-management. We need to do that assessment again of how much and what parts of management of healthcare people want. Truly informed choice might be you do it. I don't want to. I take too many. And that might be an informed choice, or the informed choice is I want to make my appointments to manage it. And she's already taking her one pill a day.
Okay. And certainly we would expect there to be self-management, and we would expect the person to be involved. And if the person said, you know, I want to be doing more, then it's likely the outcome wouldn't be present. But she hasn't
Right.
said, you know, my outcome's not met because I don't have independence in managing my health care. The next question's kind of related to that, in that it says, how is the support present when she is saying she wants to be able to self-manage without help of staff? It would seem to be an opportunity. It is in process, but not currently happening.
The question on the decision making, is the person supported to self-manage their health care? She is supported at this point in learning to self-manage her health care. So we're supporting her to manage that. She's identified it as something she wants, and it is being worked upon.
So, so the follow-up question from that is that this person disagrees and says that her outcome is not where she wants it to be. And that's true. If you have evidence that it's not where she wants it to be, then the outcome would not be met, right? If she wants to be independent in self-managing her medication or her health care, and that's not happening, would the outcome be present?
I would say it is still present, because if you look at the decision-making questions, there's not the issue of self-management in that, although she has identified that she wants to do that, which is the support question of, is the person supported? So, you know, if you find something that she's terribly unhappy with in her health and does not feel that she's in the best possible health, then that is something that you might indeed not be there. But in looking at the decision-making questions, those are answered yes for the outcome and answered yes for the support. And disagreement's okay. You know, but according to this scenario, with our decision-making questions, we see that as being present for her, because she's in the process of self-management.
Okay. All right. Thank you, Jill. So I'm going to try to put a couple of these together so that we can still get to the next outcome. Okay. So, so when someone's not able to verbally communicate why they take medications or provide information about their medications because of their cognitive ability, can the outcome ever be present?
Well, there are certain other things. There are guardianships that would be the person that would be assisting and supporting the person to make those decisions. So looking at those interventions and whatnot, and we would expect that the supports be extremely high. There's never a yes or no or always or never in what we do according to the person. So the questions of does that person see healthcare professionals? Have they identified those and addressing? Have they been the interventions selected by the person in consultation? If I have someone as my healthcare proxy, we would expect that healthcare proxy is close enough to making sure that person is healthy. So the short answer is yes, it could be. With certain circumstances being around it. We would always expect that support to be in place. If the person is receiving medications, say with a G tube or a J tube or whatever that might be for health, that we're talking to them about what is happening, that we're always, when we're giving medications, we're talking to them and explaining why they're taking the medication, for those supports that become much more robust with someone that is not speaking to us or has a representative for their health care.
Okay, great. Thank you, Jill. We're going to move on to the next area, which is experiencing continuity and security.
Sorry, I have to close you out. There we go. Lennon has a trust fund, but she doesn't know exactly what that means. She moved into her own place in the last 2 years. She planned and saved and made it happen, and she is very pleased about where she's living. Lennon has said she has enough money for basics and some things she wants. According to staff, there are no changes anticipated for her continuity. She doesn't want anything to change except for her guardian. Her program coordinator and staff have been with her for the past 2 years, and they actually helped her move. She doesn't know if she has renter's insurance or if she has a burial plan or account. She has a banking account, but she's not sure if it's checking or savings. She has $5 in her purse and can always ask for more. She said she can buy whatever she wants, whenever she wants, and by asking staff. And with that, she just needs to ask staff, and she has asked for a different. Is there another page? There should be. Is there another page?
No, there's not.
Okay. She said she can buy whatever she wants. At this time, the organization is not formally educating Lennon on her financial situation, as guardianship has taken priority. She has asked for a different guardian and knows that a guardian can make her do things she may not want to do. The process is in motion to identify a guardian that Lennon wants, but right now she wants her program manager to be her guardian. So I'm giving you a little more information. Do you want me to reread that, the additional? Okay. Does Lennon have economic resources to meet her basic needs? Has Lennon done any of the following to protect her belongings? I'm not going to read through those. Have changes occurred over the past 2 years? Who was responsible for those changes? Are changes in the following areas anticipated? And I will tell you that changing guardian is one. Is the control over changes similar to that exercised by other people? So you will notice in the decision making, if the answer is to 4.1, has Lennon the economic resources to meet her basic needs? And 4.6, is the control over those changes similar to other people? So if you will make your decisions for the outcome, and we'll go on to, and write those down, and we'll go on to the supports. Does the organization know what is required for Lennon to experience continuity and security, or are efforts being made to learn about those preferences? Are supports provided to assist Lennon in attaining and maintaining continuity and security? Based upon these answers, are supports in place to facilitate Lennon's continuity and security?
So Jill, here are the results. Most people determine that Lennon's outcome, people experience continuity and security, is not met. And most people said that the supports are not in place for Lennon.
And that is true. Correct. She doesn't know enough about it, and the organization has kind of determined And we know that the guardianship is a really big issue for her, but they've decided not to go into any more of the finances at this point because of the guardian has taken precedence over this, and she knows that her money's safe. They know that her money's safe. It's being reviewed, and so at this point in time, she has everything that she needs in that, and so she's okay with that. But her continuity and security is in jeopardy because of the guardianship issue for her. Well done.
All right.
Nicely done.
Very good. So there are a couple of questions, and we're almost out of time, but let me just, there's two questions. The first one is, can you explain and give some examples of the difference between the determination and supports in place, developing plans, aware with no plans, or not in place?
Oh, the extra things. Oh, I'm sorry. It was like, what do you mean? Yes. Those are for when you have your portal with to enter your information with CQL. We have those determining areas that you can choose when you enter your information, so that it's not just a no or a yes on supports, but rather it can give you some ideas of where you are within a process. So it's either that you're not in place because you have no awareness of it, or that the no that you're aware, you know it. This organization knows they need to do something with their finances. They know that, but there are no plans in place. So that would still be a no for them, but they could put no, so that they don't forget that there is an issue. They can be developing plans, but it means that it's not quite in place, that they're not doing, there's no action involved with the awareness, excuse me, or that the supports are in place in a robust manner, in a manner that clearly evidences support.
Great, thank you. And then the last question for today is, in this particular outcome, when it talks about control over changes similar to that exercised by other people. Can you explain a little bit about what exercised by other people means? Is that other people in the world, or is that other people who receive services?
It's always a question, isn't it? In the best scenario, it's by everybody in the world.
All right. Thank you for that, Jill. We are over time, so we need to end and respect that you have other places to be and to go. Again, we remind you that this webinar, the recording and slides will be available at the end of next week. We're keeping record of those of you who participate in this in terms of your certification requirements. And we hope to see you in June for...
in May.
Oh, I'm sorry, in May. It's only April. We hope to see you in May for the next webinar, and that will be some more of the human security section.
And I'd like to say thank you all for attending. It is May 16th. Please sign up if you'd like to. We'll be looking at rights and treated fairly, so bring your questions and we'll have a scenario. Lennon is still on the books and will be our interviewee for the entire 6 sessions of this. Thanks very much. Happy spring, and I hope it's pleasant where you are. Bye-bye now. Thanks.